There's no population for whom this is more important than children. There are so many children going hungry around the state, and it's absolutely unacceptable. Now I want to invite Elizabeth Bryant from Kids Count to tell you about why this legislation is so important for Rhode Island children.
Thank you so much, Dr. Amy Nunn, and for the leadership of the Rhode Island Public Health Institute. Thank you so much, Representative Barros and Senator Lawson, for sponsoring this important bill, and to the other co-sponsors whose work is so important to making sure that we have what we need to pass this bill, which is so important for Rhode Island's children and families. As was stated earlier, we just released our Rhode Island Kids Count Fact Book for 2021 and found a huge impact that the pandemic has taken a toll on Rhode Island's children and families, with a disproportionate impact on families of color, both the disease itself and the resulting economic impact. Rhode Island Kids Count supports this important bill, sponsored by Representative Barros and Senator Lawson, to impose a tax on sugar-sweetened beverages because we believe it's a key method to addressing two key issues. Number one, to turn around the discouraging and very explicit increase in obesity and overweight among Rhode Island's children and youth. And number two, to be sure that the 47,000 children on SNAP and their families have access to high-quality, healthy fruits and vegetables as part of the SNAP program. So first, to the childhood obesity and overweight numbers. Our latest data shows that a full 31%, almost 1 in 3 kids ages 2 to 17 are either overweight or obese. 15% of Rhode Island children ages 2 to 17 are overweight, and 16% are obese. And this starts very early. Among children ages 2 to 4, 25% or 1 in 4 are either overweight or obese. Ages 5 to 9, 29% either overweight or obese. And ages 10 to 14, 35% overweight or obese. And we are finding grave disproportionality based on race and ethnicity as well, with higher rates of both overweight and obesity for children of color, including Black children and Latinx children. So this is an issue that we need to turn around quickly, because we know that being overweight or obese in childhood is a great predictor of being overweight or obese in adulthood, and that overweight and obesity is a driving both health factor and cost factor in terms of how our kids are doing. We've already had a lot of great testimony on the health impact of being overweight and obese, so I won't review those numbers. I just want to emphasize that SNAP really is a children's program. In the latest data that we reported, about 68% of people on SNAP were adults and 32% were children. And of all of the 47,000 children enrolled in SNAP right now in Rhode Island, 33% or 1 in 3 were under the age of 6. So this is a double-barreled bill to really work on two key issues: making sure that we can turn around the trend that's showing more and more of our kids being obese, with sugary beverages definitely adding to that problem every day. And number two, making sure that our children on SNAP and their families have access to nutritious food. We know that there is far too much food insecurity in Rhode Island. We know that at least 10% of households are food insecure, and a national study showed that at least 37% of households with children with incomes below the poverty level were food insecure. So I want to thank everyone who has put their shoulder together to really work on this bill. Its time has come. We urge your support and your great advocacy over the next few weeks to make sure that it passes. And I also want to thank Andrea Heath for your incredible advocacy as a mom of 3-month-old Raiden, who's right there with his dad and grandma. I love to see advocates start out at age 3 months. Thank you so much.
Thank you.